What is sleep apnea? Sleep apnea is a sleep disorder that causes you to stop breathing intermittently while you sleep. This can lead to disrupted sleep, daytime fatigue, and even serious health complications if left untreated. There are two main types of sleep apnea. Obstructive sleep apnea. This is the most common type, occurring when the muscles in the back of your throat relax and block your airway. Central sleep apnea. This occurs when your brain doesn't send the correct signals to the muscles that control breathing. Symptoms of sleep apnea can include loud snoring, gasping or choking during sleep, daytime sleepiness, morning headaches, irritability, difficulty concentrating. If you suspect you may have sleep apnea, it's important to consult with a healthcare professional. They can diagnose the condition and recommend appropriate treatment options. What causes sleep apnea? Several factors can contribute to sleep apnea. Excess weight. Being overweight or obese can increase the risk of sleep apnea by putting pressure on your airway. Large tonsils or adenoids. Enlarged tonsils or adenoids can narrow your airway and make breathing more difficult. Family history. Sleep apnea can often run in families. Age. The risk of sleep apnea increases with age. Lifestyle factors. Smoking, excessive alcohol consumption, and certain medications can also contribute to sleep apnea. Structural abnormalities. In some cases, structural abnormalities in the face or jaw can predispose individuals to sleep apnea. It's important to note that these are just a few of the potential causes of sleep apnea, and individual factors can vary. If you're concerned about your risk, it's best to consult with a healthcare professional for a proper evaluation. How to diagnose sleep apnea? Diagnosing sleep apnea typically involves a combination of medical history, physical examination, and sleep studies. Medical history. Your doctor will ask about your symptoms, such as snoring, daytime sleepiness, and morning headaches. They will also inquire about your family history of sleep apnea or other sleep disorders. Physical examination. Your doctor may examine your throat, neck, and jaw to identify any potential physical factors that could contribute to sleep apnea. Sleep study. This is a diagnostic test that monitors your sleep patterns and breathing while you sleep. There are two main types of sleep studies. In-lab sleep study, you spend the night in a sleep laboratory, where technicians monitor your sleep using various devices, including an EEG, electroencephalogram, to measure brain activity, an ECG, electrocardiogram, to monitor heart rate, and a CPAP machine to assess breathing. At-home sleep study, a portable device is used to monitor your sleep at home. You will be asked to wear the device for a night or two, and it will record your sleep patterns and breathing. The results of the sleep study will help your doctor determine if you have sleep apnea and, if so, the severity of the condition. How to treat sleep apnea? Treatment for sleep apnea depends on the severity of the condition. Here are some common approaches. Lifestyle changes. Weight loss. Losing weight can significantly reduce the risk of sleep apnea, especially in individuals who are overweight or obese. Avoid alcohol and sedatives. These substances can relax the muscles in your throat, making it more likely that your airway will become blocked. Quit smoking. Smoking can irritate the airways and increase the risk of sleep apnea. Sleep on your side. Sleeping on your back can worsen sleep apnea by allowing your tongue to fall back and block your airway. Continuous positive airway pressure, CPAP. This is the most common treatment for sleep apnea. A CPAP machine delivers a steady stream of air through a mask, keeping your airway open. Oral appliances. In some cases, a custom-made oral appliance can help to keep your jaw and tongue in a position that prevents your airway from collapsing. Surgery. For severe cases of sleep apnea, surgery may be necessary to widen the airway. This can involve procedures such as tonsillectomy, adenoidectomy, or maxillomandibular advancement surgery. It's important to consult with a healthcare professional to determine the best treatment option for you. They can assess your individual needs and recommend the most appropriate approach. How to prevent sleep apnea? Here are some steps you can take to prevent sleep apnea. Maintain a healthy weight. Excess weight can increase the risk of sleep apnea by putting pressure on your airway. Avoid alcohol and sedatives. These substances can relax the muscles in your throat, making it more likely that your airway will become blocked. Quit smoking. Smoking can irritate the airways and increase the risk of sleep apnea. Sleep on your side. Sleeping on your back can worsen sleep apnea by allowing your tongue to fall back and block your airway. Limit medications that can contribute to sleep apnea. Some medications can increase the risk of sleep apnea, so talk to your doctor about any concerns you may have. Get regular checkups. If you have risk factors for sleep apnea, such as obesity or a family history of the condition, it's important to see your doctor regularly for checkups. By taking these steps, you can reduce your risk of developing sleep apnea. If you're already experiencing symptoms of sleep apnea, it's important to seek medical attention.